It's a huge privilege to be here. Thank you, Shannon. Thank you, Vikas, for inviting me. Yeah, oof, hard to follow. My title, what really matters? And I'm going to start with a question. Why is it so easy for us to see the harm inflicted by doctors in previous generations, and so hard to see the harms that we ourselves are causing right now? This is the English novelist Lawrence Sterne, and we marked his 300th birthday last month. And in his great novel, The Life and Opinions of Tristram Shandy Gentleman, Sterne wrote this: "Ars longa and vita brevis, life short and the art of healing tedious. And who are we to thank for both the one and the other, but the ignorance of quacks themselves, and the stage loads of chemical nostrums and peripatetic lumber with which in all ages they have first flattered the world and at last deceived it." Does that last bit sound strangely familiar and disturbing? Are we still peddling apparently therapeutic chemicals, first flattering the world and then deceiving it? I wonder. Throughout human history, unscrupulous people have sought to make money out of human illness. And today, perhaps more than ever before, they are being actively helped by the wishful thinking of good intentions. That's our wishful thinking and our good intention. So this is the increase in the prescribing of antihypertensive drugs across the richer countries of the world over the last decade, just over the last 10 years, from the lighter shade to the darker shade. This is anti-cholesterol drugs. And now, unfortunately, the US doesn't feature in either of these charts for a reason I don't fully understand, seeing as you are in the OECD. But I am absolutely certain that your increases are of a similar magnitude, if not worse. And are these rates of prescription and the costs involved justified? 10 years ago, the 2003 European Society of Cardiology guidelines suggested screening for blood pressure above 140/90 with no age cutoff, and serum cholesterol above 5 millimoles per litre. Sorry, I am embedded in European metrics, and I don't know the translation. I should have checked it, sorry. But you're supposed to use those thresholds to identify those at risk of ischemic heart disease. Now, very generously, the guidelines said that the clinician was not necessarily required to start treatment at those levels, but is expected to inform the patient that these measurements mean that they are at increased risk of cardiovascular disease. Now, Lynn Getz and her colleagues applied these thresholds to the entire adult population of the Norwegian county of Nord-Trøndelag, because the Nord-Trøndelag Health Survey had collected those measurements of blood pressure and cholesterol for the entire population of some 62,000 adults aged between 20 and 79, and they collected those in the mid-1990s. Now, as you can see from this chart, when the European guidelines are applied, half of the population was considered to be at increased risk at the advanced age of 24. By the age of 49, this proportion rises to 90%, and as much as 76% of the total adult population of this county of Norway are at increased risk of cardiovascular disease. This would be outrageous enough if Norway wasn't one of the longest living populations in human history. It is, I'm not a great scientist, but it is not possible for 3/4 of the longest living population in human history to be at increased risk of premature death from cardiovascular disease. But yet, fear is sown in every single preventive health consultation which follows these guidelines, and fear itself throws a shadow across life and undermines health. This is a massive exercise in overdiagnosis and iatrogenic harm. Now, in this book, as I think in all his work, the writer John Berger seems to identify what really matters in life as being human relationships and trying to tell the truth. And more, I believe that these are the two most important things in every aspect of human life, and certainly within healthcare. And when I started thinking about this, I thought that they were two rather separate things. But now I think that they are profoundly interwoven. So let's start with trying to tell the truth. And he has his long dead mother say this to him in the book. All you have to know is whether you're lying or whether you're trying to tell the truth. You can't afford to make a mistake about that distinction any longer. Science is the foundation of our profession's attempt to tell the truth. The serious study of medical science is absolutely essential for all of us, but it is never enough. There is much more to the practice of medicine than the science on which it claims to be based. And in trying to tell the truth, we need to acknowledge the harms of scientific medicine alongside its potential for good. Its pretension to knowledge that does not stand up to scrutiny, its exclusion of other important sources of knowledge, and its corruption by both conflicts of interest and by our own wishful thinking. People are harmed to a greater or lesser extent whenever they are objectified and depersonalized. In medicine, this is driven by a toxic combination. On the macro scale, by public health utilitarianism in the name of justice, and on the micro scale, by the imperatives of biomedical science. All we have to counter these harms are the strength of human relationships, because human relationships have an intrinsic focus on the subjectivity of the individual person. The medical technology industry enables healthcare professionals to investigate more and more minutely, to measure and assign numbers to an ever-increasing number of biometric parameters. And these numbers are almost always normally distributed along a continuum. And at one extreme, they represent a degree of abnormality which begins to correlate with symptoms and suffering that can be ameliorated or even cured by medical treatment. That bit's good. The problem is that the combination of vested interest and good intentions produces continual pressure to extend the range of abnormal, shifting the demarcation point further into the territory previously considered normal. And this is encouraged by these sorts of entrenched beliefs in old adages, such as prevention is better than cure and a stitch in time saves 9. And that we seem to imbibe these ancient sayings at such a young age that they assume an almost mythological aura of truth. And we have neglected the Popperian imperative of investigating why they might be wrong. And in pursuing the supposedly self-evident truth, we have for the first time in history separated our notions of disease from the human experience of suffering. And we have created an epidemic of disease without symptoms, defined only by aberrant biometrics. An ever greater proportion of healthcare resources are directed towards reducing these numbers to some fictitious state of normality. And in the process, those who are perfectly well are not only assigned labels that in themselves have been shown to compromise health, but are also exposed to treatments which have significant adverse effects. Yet time and time again, politicians and policymakers are unable to resist the easy attractions of preventive rhetoric. Because if nothing else, this serves to distract attentions from government's own failures to meet their own responsibilities for health protection through fiscal and legislative measures in terms of promoting greater socioeconomic inequality, nurturing vulnerable families, and such policies as minimum pricing for alcohol and plain packaging for cigarettes. Extending the range of abnormal clearly expands the markets for pharmaceutical and other interventions, and thereby the possibilities of maximizing commercial profit. And it also invokes the Will Rogers phenomenon, this particular joke having spread at least as far as between Morecambe Bay and Lancaster, to my certain knowledge. And the Will Rogers effect was first applied in medicine by Alvin Feinstein and colleagues back in 1985. And this very important phenomenon occurs whenever the range of a diagnostic category is extended. As more and more people previously considered normal are included within the definition of, for example, hypertension or diabetes or breast cancer, outcomes immediately improve. Rates of hypertensive stroke or diabetic foot amputation or breast cancer mortality appear to fall. In this way, extending the definitions of disease and lowering the thresholds for preventive interventions create the illusion of improved population outcomes, where there is absolutely no difference in the outcomes for affected individuals. And clinicians and health policymakers and politicians, we have, all of us, found it very difficult to resist these seductive illusions of progress. In the attempt to tell the truth, doubt is essential. Because of the necessity of doubting the truth of existing explanations and looking for better ones. But we also need hope. Because doubt alone is cynicism, doubt plus hope is skepticism. So we need skepticism. And the British writer Geoff Dyer, in his book about Tarkovsky's film Zona, links the capacity to generate doubt and uncertainty with the capacity for wonder. And this, of course, is an essential component of human relationships. The contemporary enthusiasm for screening emphasizes the sort of wishful thinking that clings to belief that does not stand up to scrutiny. A possible truth is being subverted into a lie. A lie within which we insist on trying to respond to the profoundest challenges of human existence through technical solutions. Look at the increase in antidepressants prescribing over just a decade. We are trying to treat all sorts of distress and unhappiness, however understandable, with a biotechnical solution that causes significant harms. And the whole discipline of medicine has colluded in the wider societal project of seeking technical solutions to the existential problems posed by the finitude of life and the inevitability of aging, loss, and death, even for Americans. At every level, this is a story of unsustainable greed. The greed of those living in the richer countries of the world for ever greater longevity, and most particularly the greed that drives and sustains the commercial imperatives of the pharmaceutical and medical technology industries. Yet the flip side of greed is fear. Fear that we or someone we love will be deprived of effective treatment because of issues of price or access to care. But neither greed nor fear can really help us. The only solutions to these profound existential challenges that have beset humanity since the beginning of time are to be found in courage and endurance and acceptance of the limits of life. They are to be found in thinking differently and more deeply, and I think we've been doing some of that today. The overdiagnosis and overtreatment that drive avoidable care have at least 4 serious implications. The first is the extent of harm to individuals caused by being labelled as being at risk or as having a disease based entirely on numbers or other aberrant investigations, and the unnecessary fear that can engender. The second involves the direct relationship between overtreatment and undertreatment, because whenever a diagnosis is broadened, attention and resources are inevitably redirected and shifted away from those most severely affected. The third concerns the potential of overdiagnosis and overtreatment to render healthcare systems based on social solidarity unviable because of the escalating costs involved. And the fourth is the way in which biotechnical activity marginalises and obscures the socioeconomic causes of ill health. This is the Armenian-American Ovidis Donabedian, the pioneer of healthcare systems research, famous for his insistence on the healthcare triad of structure, process, and outcome, and that an understanding of all three is essential to healthcare quality. Yet very strikingly, in an interview given shortly before his death in 2000, Donabedian said this: "Systems awareness and systems design are important for health professionals, but are not enough. They are enabling mechanisms only. It is the ethical dimension of individuals that is essential to a system's success. Ultimately, the secret of quality is love," which just brings us right back to the preeminent importance of human relationships. Thank you.